Hello, my name is Areli Rodriguez,
And my name's Areli.
and we are second-year graduate students at UT Health San Antonio in the Speech Language Pathology program, along with our graduate student colleagues Diana Perez and Alexa Ibarra, under the supervision of our UT Health San Antonio faculty and research mentors, Drs. Kennedy, Klinger, and Parrish. We are excited to present Learning How to Launch, empowering families to support their children's health and learning. The purpose of our study, Learning How to Launch, is to inform caregivers on the importance of language and literacy skills, as well as empower their involvement in their children's language and literacy development. During the summer months, children of lower socioeconomic areas often do not have access to language-rich environments or opportunities. They also experience an increased likelihood of having or developing a language disorder as compared to the same age peers of higher socioeconomic statuses. Our goal with Learning How to Launch was to partner with Prospera housing communities to provide the caregivers of Las Palmas Garden and West Durango apartment complexes located in San Antonio with education and resources on book reading to create increased exposure to language and literacy at home during the summer months.
Learning How to Launch is the newest component of an existing summer-based program entitled Launch. This program is the summer language enrichment program open to the children of Las Palmas Garden and West Durango apartment complexes, hosted by the Speech Language Pathology program at UT Health San Antonio. Every day for 2 weeks, speech language pathology graduate clinicians address and teach the microstructures and macrostructural components of a story through engaging play-based activity stations that aim to increase the children's opportunities to apply the language components previously learned. Each year, the Launch program provides language and literacy enrichment to approximately 20 to 25 children per apartment complex. In 2024, as a part of a Community Service Learning Grant through the Charles E. Cheever Jr. Center of Medical Humanities and Ethics, the speech language pathology graduate clinicians coordinated and hosted 2 caregiver nights at each apartment complex. Dinner and childcare were provided for the families. At the beginning of the caregiver night, graduate student leaders introduced the Launch program, which their children attended, and explained to the caregivers the language components their children were being taught during their time at Launch. Graduate student leaders then introduced the significance of book reading along with a demonstration of simple strategies caregivers could use at a home to facilitate child engagement, which included sitting in front of the child, orienting the child to the book, and following along with finger pointing and changing the pitch and prosody of voice. As discussed in the methods section, caregivers were provided pre and post questionnaires to self-rate their comfort in book reading with their children, as well as how often they read to their child at home. After the previously described graduate student leader presentation, caregivers were provided a book appropriate to their child's age and prompted to read with their child while utilizing the modeled book reading strategies. Trained speech language pathology graduate clinicians were then tasked to obtain observational data using a standardized checklist, including the target strategies under the supervision of project faculty.
The bar graph illustrates how many caregivers selected a comfort level rating for each question. The majority of attending caregivers, approximately 7 to 8, maintained that they were very comfortable in reading with their child before and after the event. A range of 3 to 5 caregivers were somewhat comfortable, while 4 to 6 were neutral post caregiver night. There were no caregivers that showed they were very uncomfortable, and one caregiver selected that they were somewhat uncomfortable to one of the pre-caregiver night questions. Comparison of pre and post questionnaire responses did not demonstrate a correlation in caregiver comfort in reading with their children. Results suggested minimal modification in the caregiver's self-ratings after the demonstration. Overall, caregivers did exhibit an understanding of the book reading strategies based on the direct observations made. According to Shinwell and DeFader 2017, caregiver collaboration within the home is essential in creating long-term improvement in their child's development and readiness for school. Despite the variations in caregiver questionnaire responses, we identified a general understanding of reading strategies from caregivers when reading a book with their child. Given the limitations in data collection, further research is recommended to identify the effectiveness of enrichment programs like Learning How to Launch and the necessary modifications for future programs. Learning How to Launch was a value added to the overall programming of the Launch program and will be sustained in future summers with future cohorts of speech-language pathology graduate students. Thank you for your time and attention. If you have any questions, we welcome the opportunity to discuss the project further. Thank you.
Thank you.